Welcome back. We're about a month away from open enrollment for the Affordable Care Act to close.
So to make sure anyone signing up is avoiding mistakes, Craig Black is here with 3 examples to avoid. And Craig, we're talking about 98% of Americans. We're trying to get them to avoid these 3 mistakes.
Absolutely. You know, I've helped tens of thousands of employees work their way through the maze of the 28,000 pages of the Affordable Care Act, otherwise known as Obamacare. But the 3 mistakes that people need to understand is, number 1, you need to define what affordable care means, right? So you need to know, do I want affordable premiums or do I want care to be affordable when I need a doctor or a hospital? Because those are 2 different things and you don't get both. Number 2 mistake to avoid, got to know what your options are. So if you're like Alex, you need to find out, hey, can I be on my parents' plan?
Yeah.
Right? Can I get something through the state? That's called Medicaid. What about through my employer? What about through the federal government on the exchange, right? A lot of options people need to explore. Mistake number 3 is assuming that your doctor or your hospital accepts Obamacare. Now, there's another wrinkle, too. If you need a specific prescription, you got to check and see if that's covered before you sign up.
So really, the umbrella over all 3 mistakes is do your research.
Exactly. Exactly. You got to do your homework.
Yes, and you have to know what you want first, and then go through and see if it falls into which category.
Exactly.
And you have like an equation to kind of help us along.
I do. I came up with a simple formula to help people learn how to buy health insurance. That's what they need. It's called Obama, right? So the O stands for options. Know what your options are, right? You have it through the state, you have it through the employer, you have it through the government, you might have it through your parents, right? And it's way too important to ask questions.
Yeah.
Right? Ask the magic 8 ball. It's not going to work, right? The B stands for budget. You got to know what your budget is, right? Because this stuff is expensive. And there's something in the law that has smoker rates and non-smoker rates. So, you know, if you're a smoker, you need to understand, it's like the Rodney Dangerfield, I get no respect, you know. It's not here yet, but it's coming. So probably next year, we're going to have smoker rates and non-smoker rates. That's a big deal. The first A in Obama stands for agents, okay? We got wonderful stars like Ellen and Pharrell and Lady Gaga have done great videos explaining why should we buy health insurance, guys? Why does everybody need it, right? But what people need to know is, how do I buy the insurance? So the easiest place to find it is find an agent at the National Association of Health Underwriters, located online at nahu.org.
Wow. Craig, you make it really simple. You know, something came to mind. It's kind of silly, but you're like the Bill Nye of healthcare. You're like simplifying it. You're explaining it all. And how widespread would you say it is that people just have no idea what they're doing?
It is very widespread. You know, there's going to be a mad rush. You mentioned it earlier. Open enrollment closes February 15th.
Yeah.
And probably 20% of everybody who signs up does it in the last week. So don't wait.
Yeah.
Right? Don't wait.
Well, and I don't want to miss we're missing the M and the A for Obama?
Yeah. M, manage your options, right? They don't use words that people use. They make up stuff like bronze, silver, gold, and platinum, right? And it reminds me of the Forrest Gump movie, right? Forrest Gump says, life is like a box of chocolates, right? You never know what you're going to get. That's how people feel when they're trying to buy this stuff, right? They have no idea what they're getting. That's a problem.
Yes.
Right? The last A stands for know your advantages. Right? Can you get tax-free benefits through the government? That's called a subsidy. Can you get tax-free benefits through the state? That's called Medicaid. Can you get tax-free benefits through the employer? Find out what your options are.
A lot of people have been talking about the subsidies and see if you fall into something. Why wouldn't you want to know if you fall into that?
Yeah, absolutely. That's what it's there for. When you go into the system, it guides you and it triggers you and it moves you into one plan, the federal plan or the state plan, right? So it's really important for people to understand. I'm holding a timer here because the simple reason that we know that the average employee, they only spend 15 minutes the whole year picking their health plan, deciding what's the most important thing for themselves or their family members. The irony is that we know that the average person spends 17 minutes picking out a new bottle of wine.
I do.
Really?
I'll admit it.
Yeah.
I'll admit it.
17 minutes. Or my favorite, 26 minutes picking out a new pet food for their pet.
Mine's more like a couple days.
Right? I mean, come on. Gooberlicious? I mean, really?
So, yeah, why take such good care of your pet? Take good care of yourself.
Yeah.
Yes.
So we want people to know February 15th is the expiration date. You got to act before then because we don't want the time to run out on them.
And then one more time, Craig, just tell us that website you were giving us.
Yeah, the website is www.nahu.org.
Perfect.
And that's where you go, and that's a good start.
It's a great place to find an agent who's a professional who can help people.
Craig, it's been a pleasure. You simplified it, and thank you so much for coming.
Thanks, Alex.
Good to have you. To learn more info, you can call 888-636-3744 or log on to craiglack.com and nahu.org.